Hello everyone, welcome back to my channel Microbiology Simplified and the PYQ series. I'm your guide and mentor Dr. Amit Kumar Singh, and I'm here again with a new video on a PYQ asked on infective endocarditis. So without wasting any time, let's start with the video. So today's topic, as I said, is infective endocarditis PYQ number 5. So let's see the MCQ. A 30-year-old male patient presented with history of fever for 3 days and malaise. Physical examination revealed splinter hemorrhage on nails. Echocardiographic examination demonstrated mass on the valves. Blood culture showed growth of organism that showed alpha hemolysis on blood agar and was gram-positive cocaine chains and resistant to optochin and bile. Which of the following bacteria is most commonly associated with the condition? So we'll see that what are the information given in the question. First is the history of fever and malaise, and physical examination revealed splinter hemorrhage on nails. Okay, and echo finding demonstrated mass on the valves, and blood culture showed growth of alpha hemolytic bacteria, which is basically gram positive cocci in chains, and it is resistant to optochin and bile. So where these informations is actually drawing us, so we will see one by one. This fever, splinter hemorrhage, mass on the valve, these three features, what it indicates, and then a positive blood culture. So this indicates to be a case of infective endocarditis. Okay, and this infective endocarditis is caused by an agent which is gram positive cocci. So this is a bacterial endocarditis, and this gram positive cocci is resistant to occur. First of all, it occurs in chains and shows alpha hemolysis and is resistant to optochin and bile. So what it could be on the basis of these information. Okay, if you don't know any of these detail, so we'll continue with the lecture, or else I will tell you right now here itself that bacteria which occur in chain and shows alpha hemolysis. If it's showing alpha hemolysis, then it could be either pneumococcus or viridans streptococcus. Okay, pneumococcus or viridans streptococcus. As it is mentioned, it is chain, and also it is resistant to optochin and not bile soluble. That means it is viridans streptococcus. So among the option given, which one is the viridans streptococcus? This is the viridans streptococcus, that is streptococcus sanguis. Okay, and this is group D, this is group B, and this is group A. So what is group B streptococcus? Streptococcus agalacti, and group A is streptococcus pyogenes. Okay, so the correct answer to the question is streptococcus sanguis. Okay, so this is the way to approach and solve the question. Okay, so let's see some detail about infective endocarditis, that how we have come to the conclusion that the diagnosis is infective endocarditis. So there is a criteria to diagnose a case of infective endocarditis, and that criteria is called as Duke criteria, and there is a certain modification in that, and which is currently being used is modified Duke criteria. So modified Duke criteria has got certain major criteria and minor criteria. Major criteria are primarily 1 and 2, and minor criteria are 5 in number. Okay, so we will see the major criteria. The first major criteria is positive blood culture. Okay, so as in the question also it was mentioned, the blood culture showed growth of alpha hemolytic bacteria. So positive blood culture, one major criteria was meeting, and second, it showed intra mass on wall. So again we'll see which major criteria it was meeting. Okay, so this positive blood culture, so how to define a blood culture is positive or not? Okay, so first of all, it should show a growth of typical microorganism causing infective endocarditis, and it should be shown in at least two separate blood culture which is drawn at least more than 12 hours apart. Okay, two separate blood culture which is taken more than 12 apart, and the organism which is commonly known to be associated or typical microorganism for infective endocarditis are Viridans streptococcus, Staphylococcus aureus, Enterococcus, and Hesse group of organism. Okay, and or not and or persistently positive blood culture. What does it mean? That means if 3 is taken, so all of 3, and if it is more than 4 or 4, then majority should be positive. Majority of 4 or more for organism known to cause infective endocarditis. So consistent recovery of microorganism known to cause infective endocarditis if it is persistently positive, that is all of the 3 separate blood culture and majority of 4 or more blood culture. And what should be remembered, that these 4 or more blood culture if you are taking, then the first and second should be taken at least 1 hour apart. Okay, the first and not first and second, sorry, first and last should be taken at least 1 hour apart, or single blood culture positive for which organism. Even if single blood culture is positive for Coxiella burnetii, it will be considered as a positive blood culture. Okay, then evidence of endocardial involvement and how it will be evident, either echo findings. And what should be the echo findings? Presence of intracardiac mass on valves or implanted material, or there may be abscess or new partial dehiscence of prosthetic valve. Okay, so either presence of a mass or abscess or new partial dehiscence of implanted prosthetic valve, or if there is new valvular regurgitation is present. Okay, so any of these two criteria if it is meeting, then we consider it is a case of infective endocarditis. If suppose if only one criteria is meeting, then at least 3 of these minor criteria should meet, or if none of the major criteria is present, then these all 5 minor criteria should meet. Okay, then only it can be considered as a case of infective endocarditis. So the minor criteria are fever more than 38 degrees Celsius, predisposing heart conditions or IV drug abuse, and vascular phenomenon such as arterial emboli or septic pulmonary infarct, or dilation of arterial, that is mycotic, dilatation of arterial valve, that is mycotic, aneurysm, or either intracranial or conjunctival hemorrhage. Apart from this, a characteristic lesion called as Genway lesions. What is Genway lesion? Genuine are non-tender erythematous macules or hemorrhagic macules on palms, okay, are called as genuine lesion. It may be present in palm, it may be present in soles, okay. So genuine lesion is a characteristic vascular phenomenon which is considered as minor criteria, okay. And then certain immunological phenomena such as Roth spot or Osler's nodes or splinter. This splinter hemorrhage is actually not immunological phenomenon, is a vascular phenomenon which I left. Okay, this is splinter hemorrhage. So Roth spot, Osler's node, and rheumatoid factor. Okay, so these are immunological phenomena. And microbiological, what we can say, positive blood culture, but not meeting the major criteria. That means maybe not positive in two separate blood culture, or maybe if we are taking a set of three, then maybe only one or two are positive, like this. Okay, so positive blood culture is there but not meeting the major criteria, or serologic evidence of infection of microorganism commonly associated with infective endocarditis. So I'll show you the images of this. First one is, okay, this handwriting is over this, so the first one, if you can see here, I'll just encircle it. It may be difficult for you to see. This is the Genway lesion. Okay, these you can see, these are the splinter hemorrhage on the nails, which is mentioned in the question also. So these are the splinter hemorrhage. So okay, now this is okay. I'll have to erase this. So this is the white centered, you can see this white centered retinal hemorrhage. So this is Roth spot. This is Roth spot. And these are tender erythematous nodules on palms. And these are what? These are Osler's node. Okay. So now there are certain causative agents which are commonly associated or called as typical microorganism for infective endocarditis. So it varies from different clinical entities. Like for native valve endocarditis, that means not the prosthetic valve. Okay. So the native valve endocarditis is classified again into two types: healthcare associated and community acquired. So healthcare associated, if you see, is commonly caused by Staphylococcus aureus. And this community acquired is commonly caused by Viridans streptococcus. Remember it like this. Also, this cones and enterococcus, that is coagulase negative staphylococcus and enterococcus faecalis, is also associated with healthcare associated. However, community acquired is commonly caused by Viridans group of streptococcus. And this native valve endocarditis may also caused by Hesse group and pneumococcus. So just for a quick recall, Hesse groups include Haemophilus parainfluenza, Aggregatibacter, Cardiobacterium hominis, Echinella corridans, and Kingella kingi. Okay, so these are the organisms gram-negative bacilli which belongs to Hesse group, commonly causing infective endocarditis. Then prosthetic valve endocarditis, if you see, it may be early, it may be late. Early means less than 12 months of implantation. Late means more than 12 months of implantation. Again, if you see early, late, it is the same as the Viridans group, same as the community acquired, that is the Viridans streptococcus. For early, it is now more commonly the coagulase negative. And what is that? That is Staphylococcus epidermidis, and followed by Staphylococcus enterococcus. So this sequence just suffered in this. Okay, here staph is more common, here cones is more common, but here it remains same. Okay, endocarditis in IV drug abuser, right sided if it is, so Staphylococcus is more common, and the valve commonly involved is tricuspid valve. and left-sided it is Enterococcus followed by Staph and group B Streptococcus. Subacute endocarditis, again it is commonly caused by Viridans Streptococcus followed by Enterococcus, Cones and Hesse group of organism. Okay, so these are known to cause subacute endocarditis. Okay, so just remember this. This is going to be helpful for so many questions are in the examination. Okay. Now the Viridans group of Streptococcus, it includes Streptococcus mitis, Streptococcus mutans, Streptococcus salivarius and Streptococcus sanguis. And it is known to cause what I told you, subacute bacterial endocarditis. And the mostly responsible among these are, this is Streptococcus sanguis. Okay. And what happened? Usually following dental extraction, transient bacteremia will occur, and these organisms will get implanted on damaged valves or prosthetic valves and grow to form vegetations. Okay, so this is the pattern of infection seen in this alpha hemolytic Viridans group of Streptococcus. Okay, so the history, the patient should give history of dental extraction, and after that dental extraction, transient bacteremia, that means the bacteria will enter into the bloodstream and then reach the heart and implant on the damaged valve or prosthetic valve and form vegetation or mass or intracardiac mass. Okay, so how to differentiate this alpha hemolytic Viridans group of Streptococcus from alpha hemolytic pneumococcus? So it's very easy. The first one, this Viridans, is non-capsulated, whereas pneumococcus is capsulated. So as it is non-capsulated, so it will give negative quelling reaction. Okay, for quelling reaction you can go my PYQ number 3, and it is negative for another 3 things, that is negative bile solubility, it is non-bile soluble, it is negative optochain sensitivity, that means it is, okay, it is optochain resistant, and then it is non-inulin fermenter. So by this we can differentiate between Viridans Streptococcus and pneumococcus. Okay. So this way you will be able to answer almost all the question asked on infective endocarditis. I hope I was able to explain the topic, and certainly I believe this is going to be helpful for you in the upcoming PG examinations. All the best. Take care.